Hi, everyone. Thank you so much for joining us today. We're going to give folks a couple minutes to get logged in and connected to audio. In the meantime, if you could please use the chat to introduce yourselves. We'd love to hear your name, your pronouns, your organization, and where you're calling in from. And when you're using the chat, please make sure the to line is set to everyone so we can all see your message. So once again, thank you so much for joining us today. We're going to get started in just about 1 or 2 minutes. Hi, everyone. Thank you so much for those of you who are putting your name, pronouns, and organization in the chat. It's great to hear from you. Thank you so much for joining us. If you've not done so already, please go ahead and put your name, pronouns, your organization, and where you're joining us from in the chat. And make sure the to line is set to everyone so that everyone who's joined us today can see your message. We're going to give folks 1 more minute to get logged on, then we're going to get started. Hello, everyone. Thank you so much for joining us today. Today we have a panel discussion on disordered eating within transgender populations. Thank you so much for joining us today, and thank you to those who are putting your name, pronouns, organization, and where you're joining us from in the chat. Please go ahead and continue to do so. We'd love to hear from you. Today's session is brought to you in partnership with the Center of Excellence on LGBTQ+ Behavioral Health Equity and the National Center of Excellence for Eating Disorders. I'm going to go ahead and pass it to our moderator for today's discussion, Angela Weeks.
Thanks so much, and hi everyone. We are really excited for today's discussion. We'll be talking about disordered eating within the transgender population and what transgender individuals may be going through if they have disordered eating, and what are some things that clinicians and providers should be aware of, should ask about, should think through when serving their consumers who may be transgender or dealing with gender dysphoria. And so we have a really excellent panel for you today. I'll be moderating the discussion. Again, my name is Angela Weeks. My pronouns are she, her, and hers, and I am the project director for our Center of Excellence focused on LGBTQ+ behavioral health equity. And so I'm really excited to have our panelists jump on, and they are going to introduce themselves. They all come with a wealth of knowledge around the populations on this topic, and so they'll talk a little bit about that. But I also just want to flag that these sessions are also meant as an opportunity for you all listening in to ask questions of these experts. And so we have some questions that we're going to go through, so we make sure we hit important topics related to the discussion, but we also want your questions and comments in the chat as well. And we will prioritize any questions that come in. We do have team members monitoring the chat and will help us try to get to everything today. Anything we don't get to, we'll try to send a follow-up email for. So again, thanks for being here. Really excited about the discussion and hope to get a lot of feedback and comments from all of you who are joining in today. And so with all of that being said, I'm going to jump into introductions. And Ryan, I'll start with you first. If you could tell everyone your name, your pronouns, and then your relationship to the topic.
Sure. Thank you, Angela. Hi, everyone. My name is Ryan Papchik. My pronouns are he, him. I am particularly interested in this topic because I have a history with disordered eating, as well as I am a trans man myself. And this particular topic intersects several of the things that I have experienced personally, as well as seen in my clinical experiences as an LCSW. Looking forward to today's conversation.
Thank you so much, Ryan. We're really glad you're here. And Martha, would you like to go next?
Hi, everyone. It's great to be here. I'm Martha Perry. I'm an adolescent medicine physician at the UNC School of Medicine and the chief of the adolescent medicine section there. I will be offering perspective as a gender affirming eating disorder provider, and also want to say that I acknowledge that I live a life as a straight, white, thin, cisgender individual with a lot of privilege. And so that also limits my perspective, but I do hope as a provider today to offer some perspective. And thanks everyone for being here and for your questions.
Great, thanks so much. And I'll just let the listeners also know that Martha has done a previous webinar with the National Center on Disordered Eating, and it was really excellent. And so for those folks needing more information and wanting to hear everything that she said in that session, we'll drop the link in the chat so you can access that. So Ashley.
Hi, everyone. I'm Ashley Austin. I'm a professor of social work in Miami, Florida, and I'm a consultant to the Center of Excellence with Angela and team. So I'm very happy to be here. My expertise tends to focus on working with trans and non-binary individuals across the lifespan. Over the last few years, I'd say I've been working particularly with folks around gender dysphoria, gender affirmation, and then moving toward gender euphoria. So thinking about those things a lot and how they intersect with eating disorders and body image. And I'm super thrilled to be part of this panel because I, along with Angela and Ryan, was able to watch Dr. Perry's webinar some months back and really loved the talk, and I'm excited to continue the conversation here. So hopefully you all will get a chance to learn along with us. So welcome.
Great, thank you so much. And so I think to kick off the discussion today, it would be great to hear a little bit about the prevalence of disordered eating within the transgender population, and also what's the importance of this conversation today. And so I'd love, Martha, if you could kick that off for us and talk a little bit about that, that'd be great.
Absolutely. First, I just want to mention that disordered eating in general has increased tremendously during the pandemic for all populations. So really important to keep that in mind as we talk about disordered eating today. And there are a lot of hypotheses as to why that's happened, but it probably has to do with social isolation, worsening mental health, increased time on social media, and a public emphasis on weight gain that's occurred, especially at the beginning of the pandemic. And then to your question, we know the prevalence of disordered eating among individuals who identify as transgender or gender diverse is higher than those who identify as cisgender. And there are varying estimates in terms of that prevalence, around anywhere from 2 to 18%, which is higher than the general population. There's a Massachusetts study that identified that youth had transgender youth had about 3 times the likelihood of fasting for more than 24 hours, 7 times the likelihood of using laxatives, 9 times the likelihood of using diet pills compared to cisgender males. And another study in Canada that showed that trans females had 10 times the likelihood of restricted eating behaviors, and trans males 19 times. And several other studies that highlight that there being a risk. And it's important to know that there's actually maybe an underestimate because the diagnosis of eating disorders in transgender and gender diverse youth is often delayed, and probably partly because it's often an otherwise specified feeding and eating disorder, what we call OSFED in the eating disorder world. That's the most common eating disorder diagnosis for transgender and gender diverse youth, and that's outside of the typical classifications of anorexia or bulimia that many providers in particular are used to. We know that also transgender and gender diverse youth with eating disorders are much more likely to have some of the more serious mental health outcomes associated with eating disorders in general. So about 20 times higher likelihood compared to cisgender youth with eating disorders to have suicidality and other other serious complications related to eating disorders. You know, as an adolescent medicine physician, I provide gender affirming care and eating disorder care, and the pressure to achieve this certain binary masculine or feminine body standards is intense for everybody, but certainly particularly for those who are transgender or those who are experiencing significant gender dysphoria. And the means that are then shared on social media platforms to achieve these standards are frequently, if not consistently, methods that facilitate disordered eating behaviors. These binary standards also exclude individuals who don't identify as gender binary and or who identify as gender fluid. So they may feel too masculine or too feminine, or like they're not meeting beauty norms that are also binary. And so what I've seen with patients presenting for gender affirming care is there often hasn't been as much attention, if any, to disordered eating behaviors by providers, or vice versa, patients that are referred for eating disorders who have not had gender dysphoria or gender affirming care needs identified. And so that's where I think we really want to talk about how those two are interrelated and why it's so important that when we're managing one, we're asking about the other and ensuring that we're skilled at assessing and or hopefully managing the other. The other really key thing is to recognize that disordered eating in individuals who are gender diverse can result from gender dysphoria. It can result from body dissatisfaction or both. And so really important not to assume one or the other, but to really explore with your patients or clients what the root of the eating disorder might be, and understanding that it's often complex and unique for each individual. I think the last thing is just to mention that, again, many eating disorder programs are, although they're improving, are still not equipped to provide gender affirming care. So in one study relatively recently, about 40% chose not to disclose their gender identity when in eating disorder treatment. Of those that did disclose, 10% felt they were ignored or not acknowledged. Another 20%, so 1 in 5, reported that it was extremely difficult or impossible to find providers who specialize in both. And oftentimes, again, as I mentioned, they're very intertwined. So hopefully many of you are here today to learn more about this and be able to help manage both and not lead individuals to feel further marginalized by passing back and forth or deferring to an eating disorder provider for eating disorders, or to a gender affirming care provider for gender care, and really trying to merge the two.
Thank you. That was a lot of really great information it was perfect, as it sets a really good foundation for the conversation, right? And I don't think that people realize how people might be experiencing both of these circumstances at once and how to talk about it. So I thought it was a really helpful foundation to set. And then we had one person in the chat ask for you to repeat what the term was associated with with trans population and eating disorder. I think they missed the specific terms you were mentioning.
Sure. I think I mentioned OSFED. So that's OSFED, and that's otherwise specified feeding and eating disorder. That's a DSM-5 diagnosis. Some people will refer to it as eating disorder unspecified. And I think that one of the things to recognize is that Anorexia nervosa, for example, has a specific BMI that is part of the criteria for diagnosis, and bulimia nervosa has a specific number of binge purges that qualify for the diagnosis. So there are many individuals that engage in disordered eating behavior that wouldn't meet that criteria, but would meet the criteria for OSFED. So that's why it's important to learn more about that diagnosis and recognize the existence of that, as well as even subclinical eating disorders or disordered eating behavior that may not meet criteria for any eating disorder, but are still potentially harmful and ultimately could lead to a more serious and more dangerous eating disorder.
Thank you for clarifying that. And then there was another question specific to what you were saying about types of eating disorders. Someone asked, is there a type of eating disorder that was most prevalent in the, they sort of broadened it to be LGBTQIA population?
I should probably stop muting myself. OSFED would still be the primary diagnosis for LGBTQIA youth in general.
Okay, yeah, that's helpful. Thank you. And I think it's fair to, or safe at least for now, to go on mute if you wanted to, because I'm going to pass a question to Ashley. So Martha had mentioned gender dysphoria being, there's a potential connection with disordered eating, and Ashley, you've done research on this and you have a lot of expertise around gender dysphoria. So I'm hoping you can talk a little bit about what that is and what some of the symptoms might be, and then how it relates to potentially disordered eating.
Thanks, Angela. Yeah, so I see there's, I was trying to like look at the chat when everybody was joining in. There's a lot of different people that I can tell from different sort of approaching this from different sort of leads, right? Maybe leading with the eating disorder expertise, or leading with the maybe trans or non-binary expertise, depending on where you are and what your location is. And so I think hopefully this doesn't bore anyone who knows a lot about this, but gender dysphoria obviously is, the key diagnosis for folks in the DSM, right? However, the way in which I and Ryan and I work together a lot, Ryan and I have been looking at this and sort of really focusing on things in both the research and then in our clinical practice, has been really thinking about gender dysphoria as like in the way that it affects people in their daily life, not like the checkbox of 1 through 6 criteria, which, as anybody who's looked at that doesn't tell you very much, right? But really sort of the way gender dysphoria manifests in anybody's life. And so the idea is, the way that experience is sort of quite distressing, right? The key term is sort of a lot of distress, and it's really related to the way in which one's sort of physical self does not align with one's internal self, right? And there's lots of different areas around that. And some people are thinking about it broadly in terms of, primary and secondary sex characteristics, but it really is a lot of different things. And a lot of the ways in which, especially sort of one of the papers Ryan and I are working on right now, really looks at certain things that really sort of make sense with body image or eating issues and the way in which sort of men and women are looked at in society. So things like shoulder size or hip size, or waist shape or back shape, and height, so all these different things. So part of the way in which gender dysphoria is experienced is sort of this deep level of discomfort, and that can range from excruciating pain, emotional pain and distress, to sort of mild discomfort on any given day. It's pervasive. It can be related to sort of all aspects of self. Today, we're sort of focusing on some aspects of self that are particularly relevant to eating behaviors, or the ways in which somebody's body can change, right, as a result of eating. And so gender dysphoria, usually when I see clients, they're coming to me for gender dysphoria specifically, or to explore parts of their identity, and gender dysphoria is salient. What I've noticed a lot and sort of started to realize was many folks who were coming to me with either disordered eating or actual diagnosis of eating disorder diagnoses, and I just do a private practice, so small clinic, that they had been in treatment for many, off and on, right? I'll see adults in teenage years or adult years, and their eating disorders had been maybe treated, but either their gender dysphoria had never been assessed, and I think Martha touched on this, never been assessed or explored, or they knew about it, but never really brought it up because didn't feel like it made sense in that venue. That doctor didn't seem to know anything about it, or that therapist didn't. And so it was really, really distinct. Sometimes the clients would have never thought about the two together, right? It seems like a no-brainer maybe to us today joining this this webinar, but for folks, it was sort of really like, no, I just don't like my body size, or I don't like the way this looks, sort of, and not really recognizing the way in which that intersects with other aspects of dysphoria. And so I think part of what Martha was saying is a lot of times people are not sort of assessing for both at the same time. When people don't understand, and I would say most people, you know, I would probably say most people don't understand gender dysphoria, trans people's needs, a little bit, let alone a lot. And so what it really needs is a deeper understanding, a nuanced understanding of what it feels like to feel gender dysphoria related to different aspects of self, starting in adolescence, right? Early adolescence, as you're moving into, as your body's beginning to change, and then obviously throughout the lifespan, but also thinking about, you know, and I think we'll get into this a bit, and Martha actually talked about the way her clinic actually allows for both gender affirmation and treating the eating disorder together. And sort of what you'll find in the research is when folks are able to be affirmed, a lot, not always, but a lot of times this begins to address some of what they were able to achieve probably in a less healthy way by managing their eating in less healthy ways. And there's actually research that sort of talks about the ways in which folks might not even conceptualize their eating behaviors as disordered. They're really thinking of them as ways to control their own bodies without gender affirming care, or in the absence of, or the refusal of, or even depending on where a client is in their own understanding, before they fully understand their gender specific needs. And so part of our work as clinicians is to help folks sort of help them understand their own gender identities within, you know, whatever those are, binary, non-binary, how those relate to their sort of experience of their own bodies, how those might relate to eating disorders, healthy eating, body image, sort of all these complex things. And I think what's been happening is a lot of this work is being done in silos. And so we're here today to try to bridge a little bit of the gap today. And I see, like, I have trouble ignoring the chat. So I saw some things earlier where people were sort of asking about, you know, slides and different things. And so I just think folks have to recognize this. We're just like dropping a little bit in the bucket today. There's so much to learn, so much to think about. We're going to share Martha's previous session, as well as some articles, because I think in a lot of ways, what we're hoping to do is just whet your appetite to learn a lot more about this, because both gender dysphoria, gender affirmation, and then of course eating disorders and disordered eating broadly are really, really complex topics. So hopefully we start to answer some questions and then give you some more resources. So welcome, and hopefully that's a helpful start.
Thanks, Ashley. And since you're sort of checking out the chat, I think there's a conversation happening around terminology, and I'd love for you to just look over what folks are saying in the chat, because I think you'll have something to add to that conversation too. So I'm not sure if you're
like, you want me to just read the chat and weigh in the chat, Angela, or do you want to raise
no,
it?
I'll circle back to you. I just want to give you a chance to sort of read
Thanks.
what folks are saying. And then I wanted to pass the conversation to Ryan too, because I'm sure you have lots to say about everything that's been talked about so far. But in previous conversations too, we've talked about the unhealthy ways that the media can contribute to this issue. And so I want to give you some space to talk about that.
Sure, thank you. So I think Martha and Ashley both touched on this a little bit in looking at how social media and society has deemed for women, there's a certain level of a beauty standard that is, you should be small, you should be dainty, you should be hyper feminine, you should have curves. And so as trans women see these societal expectations, it can be increasingly difficult to reach them through hormones alone or pre-transition. And that can be frustrating, and they can sometimes turn to disordered eating or developing an eating disorder to attempt to reach some of these unattainable ideals held by society. So that can sometimes also look like, for trans men, they should be muscular, they shouldn't have curves, it should be like a straight line through their hips and washboard abs and things of that nature, where sometimes that can be problematic for folks that are not able to achieve those standards, those societal standards that are very unattainable. So I would also like to touch on, as far as societal standards, some trans youth using disordered eating to either slow or stop the onset of puberty and secondary sex characteristics, especially using their body, manipulating their body in a way that slows that process down, especially if they're not getting access to gender affirming interventions. It can be incredibly harmful for them at such a young age doing those things, because it can lead to further issues down the road as well.
Thank you, Ryan. And then Martha, I see you're off mute.
Yeah, I was going to say, Ryan makes a really important point about, when there's gender dysphoria and individuals don't have access to care, for lack of a better word, the quickest and easiest way to make some changes is to engage in this disordered eating behaviors. And I think validating that for those experiencing that is a really important part of the work that we do, as well as educating those in their lives and those that may be restricting their access, what the damage that can be done is, and how important it is to ensure that the care for both eating disorders and gender affirming care are happening as soon as possible, so that there's not any long-term health consequences. For example, bone density for individuals that are restricting to avoid having menses, that can really cause long-term issues that we want to be aware of.
Great, thank you. Yeah, I think that's a really important point to make, that like what folks are experiencing in the moment and how all of this is related. And there's so much more to talk about, but I wanted to circle back to Ashley to see if you had thoughts on the conversation in the chat about language. And
yeah, I was trying to sort of catch up to it all. I think that the conversation was sort of this idea of whether we should use sort of assigned female or male at birth, or whether we should use trans mask or trans. Is that the sort of conversation, Angela? Yeah, and I think, we had a conversation the other day at the center, and I think in general, when I am talking about people, we sort of talk about, I use the word trans, or trans folks, or trans mask, or trans feminine, or non-binary, right? But every once in a while, I think every once in a while, for providers, there may be something useful about understanding assigned sort of sex or gender at birth. And so we may have to, in clinical settings, talk about it that way in some instances. But as a rule, I agree that it's not just sort of, that's not we don't want to center that part of someone's experience. It may obviously be necessary when we're doing someone's clinical care to understand maybe someone who's non-binary, understanding their experiences and how, that's important. But I think as a rule, it is, I think I agree. It's important to use sort of the identity that someone is using now, rather than centering the birth identity. So I think that's an important point that was made in the chat. And so, does anybody else want to add to that, or does that sort of capture what you're thinking of, Angela?
Yeah, I think that is really helpful. And also, I've also heard conversations about saying gender assigned at birth instead of sex assigned at birth, because it is gender that's being assigned to someone. And so I think that I've heard that conversation too, and I think it's valid. And to Ashley's point, depending on the space and sort of your what you may be having these conversations around and with who, might determine a little bit of the language you're using. But I think as a field, and as folks who are really trying to raise awareness in the field about the population, we're always looking to the community to figure out sort of what is the best language we should be using, what feels right to folks. And so we really value that community feedback. So I just wanted to provide some space for that. And I also wanted to circle back to something that, Martha, I've heard you talk about before, around folks on who have autism spectrum disorder and the prevalence within that community and how this all ties together.
Thank you. Yeah, I think that's a really important part of when discussions, both related to eating disorders as well as when talking about gender affirming care. What we know from the literature and from experience clinically is that there is a higher number of individuals who identify as transgender or gender diverse, who have characteristics of neurodevelopmental conditions like autism. there are studies evaluating children with autism that show a prevalence of what was described in the literature as gender variance. So I try to quote what was in the literature when I'm quoting from that. And that's where sometimes today I may use terms interchangeably, and it relates to how those terms were used in the literature, but they may not be the terms we're using today or that I would use. But anyway, prevalence of gender variance being about 4 to 5% in children with autism compared to children without autism, that's maybe around 0.7 to 1.3%. There's other studies with varying sample sizes estimating anywhere between 5 to 25% of children presenting for gender care have a clinical diagnosis or characteristics of autism, which is higher compared to the population of about 1 to 2% prevalence of autism. And there's speculation, which I think is very reasonable, that some individuals who identify as transgender or gender diverse are overdiagnosed with autism, and that some of this is due to social discomfort associated with gender dysphoria, or potentially gender biases, where individuals expect certain characteristics based on the gender assigned at birth or gender identity. There's a recent large-scale study using some validated autism diagnosis tools that found that transgender or gender diverse individuals were about 3 to 6 times more likely to be autistic compared to cisgender individuals. The study looked at self-reported neurotypical and neurodivergent behaviors, as well as whether individuals self-reported that they suspected they had undiagnosed autism, and all reports were higher in those areas among those who identified as transgender as compared to those who identified as cisgender. So of course, though, the tools that were used for diagnosis were probably validated in a limited, mostly gender binary population. So it's, I think, always important to be skeptical or to, think critically when we're reviewing this data. There are some hypotheses regarding the association between gender diversity and autism. Neurodivergent individuals may conform less to societal norms compared to neurotypical individuals. And this may partly explain why a greater number of neurodivergent individuals identify outside the stereotypical gender binary. Others have proposed a neurodevelopmental role or genetic connection between autism and gender identity. Some also hypothesize that minority stress experienced by individuals who identify as transgender or gender diverse contributes to development of autistic traits or characteristics. There's a lot of variety of hypotheses out there. One of the things that I think is really important is that individuals with autism who are transgender also report experiencing providers not believing that they're transgender because the individual reports it in a more matter-of-fact way or unemotional manner. And so that's something that's really important to keep in mind. I guess needless to say, this is very complex. What I think is most important is to meet our patients where they are and let them help guide their care and their visits. For some individuals that have autism or autism traits, this might mean shorter appointments, respecting sensory issues around certain food types and textures. So that leads me to kind of thinking about the context of eating disorders. And it's really important to understand that individuals with autism might have disordered eating due to those sensory issues. They may have discomfort and sometimes really severe discomfort with a taste, a smell, a texture, or other characteristics of foods. So then that alters the traditional framework that we might use to treat the eating disorder. So understanding, again, what's triggering the disordered eating behavior, as we talked about before, is really important. Is it body image? Is it gender dysphoria? Is it sensory issues? Is it all of the above? Making sure, again, that we're assessing for those triggers and understanding what the limiting factors might be in terms of care. And definitely welcome questions. I don't know that I have all the answers to this one because I think, again, as I said, it's very complex as well as a lot more to be understood. And I think, again, as I mentioned, based on research and tools that probably has a fair amount of bias in it, but I'm hoping this generated some questions and discussion.
Yeah, I think it certainly did. And I see Ashley's off mute. So Ashley, do you want to add to that?
So I don't want to take the conversation elsewhere because this is really important, but it's something Martha said is, to me, is sort of the bigger issue in some ways about this. So one of the things that Martha just said is that a lot of times kids that are diagnosed with autism and then also identify as trans or non-binary, are their identities, their trans or non-binary identities are dismissed. They're said that they don't, they can't know, they don't know, and they're sort of really invalidated. And what, one of the things that reminded me of is that actually kids sort of kids who are trans, their identity, or young people, we're sort of talking about young people, but this is obviously affects young adults and adults as well. But people who have eating disorders or often have their gender identities dismissed as well. I mean, trans identities get dismissed for a million reasons, but this is another one to think about, because a lot of times what happens is people say, well, they have an eating disorder. They're just really not comfortable with their body. They've always had body image issues. And now they're just saying it's this. And so I've seen a lot of invalidation and dismissal as people come to understand their gender identity and their gender dysphoria, either as a part of treatment or outside of treatment, and they start to sort of proclaim to themselves in the world their new understanding of self. This often gets invalidated by practitioners, certainly parents, other providers, and this often gets looked at really skeptically. And I think it's because there's a major misunderstanding about how one comes to understand gender dysphoria, their identity, that they would sort of miss that, well, this is a very obvious sort of, this can certainly become sort of a new into awareness. You can sort of understand yourself better. And so this idea of sort of wanting to minimize trans identities or experience of gender dysphoria because A, they have this, or B, whatever. So I think that's a really important point that I just wanted to sort of mention, the way in which all of these things, when they intersect, lots of identities get sometimes just missed altogether. And then when they are raised, they're often dismissed or invalidated or pushed to the side or questioned by those of us who should certainly know better. And then I wanted to make one other point related, before I forgot it, related to what Martha said, which was this idea of meeting our clients where they are. So this idea of, and this would apply whether we're working with clients who are trans and have disordered eating and on the spectrum, right? So any of those things. And also this sort of all this stuff that was going on in the chat of, we present data to you because data is really helpful in elevating sort of our awareness of the problem, right? That eating issues are really common in lots of people, as Martha raised today, especially now, but particularly in the trans community and for the reasons we talked about. And so I would say in some ways I wouldn't want us to get too hung up on what's more typical for trans men, what's more typical for trans women, what's more typical for non-binary folks, because really what we should be doing is sort of saying, if I deeply understand trans experiences, I'm gonna have a sense of how to navigate issues around, but I'm going to understand that body image is probably going to be a concern I should explore. And maybe sort of restrictive eating or other sorts of eating behaviors that could be problematic are also things that I should be sort of exploring together. Same thing, if I understand eating issues, I might want to really understand this, but I wouldn't want to really sort of, we don't want to box anybody in. These are sort of, especially when you think about non-binary folks, and I think Lindsay just shared a couple, one of them is a qualitative article and one's a synthesis, and they really get at the nuance, because part of this conversation is about sort of saying, hey, here's a really big issue that we all seem to be missing in our field, and let's understand it from a really nuanced way. Never sort of, we don't want to say, oh, because I have a trans masculine or a trans man in front of me, here's what I know is going on. We want to say this may be something, but let me explore what might be going on for this particular person. And so in some ways, thinking about it from a really sort of, we don't want to think about it in too many silos. We want them to sort of just this sort of understanding, and then what may be affecting any one person. And then last thing I'm going to say, and then I'm going to shut up, is that one of the folks sort of was asking, like, well, how do we bridge these gaps? And I would say by really sort of delving into the research and then thinking about how to apply it in a really nuanced way to any client in front of you, right? To really being fully present with that client and thinking about what they're saying and how this might relate, given what we understand about these different mental health concerns that we're talking about. So thanks.
That is everything you just said. I love it. Thank you, Ashley, for jumping in and adding all of that. And I saw that while you were addressing that, Martha actually answered the question in the chat. So for those wanting clarification on the prevalence, that's now in the chat. So thanks for doing that. And I think it's a good time to sort of shift the conversation, and Ashley already started this bridge to, what should practitioners be doing? And I think, Ryan, if you could kick off that question, that'd be great.
Yeah, definitely. So I think a very simple starting place for folks that are working potentially in an eating disorder clinic or something of that nature is to start to think about how is the space affirming for young trans folks coming in? Because if they don't see themselves represented within the space, they're not going to want to share their identity, which can lead to further issues down the road with disordered eating because they're not sharing that part of their life with you. And then on the flip side of that, clinicians that are seeing trans youth for gender need to also be looking at, okay, I'm assessing gender dysphoria, but I also want to consider eating habits and how disordered eating can play a major role in some cases with their gender transition and how they are sort of manipulating their body to either slow puberty or secondary sex characteristics. They're basically taking it within their own hands before they're able to access gender affirming interventions that would help mitigate some of these eating issues.
Thank you for that, Ryan. And then I'll go to Martha next.
Yeah, I mean, I think that Ryan said it really well, that if you're, let's try to get rid of the silos and try to ensure that we're assessing for both in all environments. In terms of when patients present for any type of care in the clinic that I work in, everyone is asked about gender identity, and it's asked more than once. It's asked along the way, and we talk about how there are changes in our identity over time, and so making sure that individuals have the opportunity to share their gender identity when they're ready to share it, and that may not be the first time we meet them, even if we try to demonstrate being a safe place and a safe space. If they've had bad experiences with healthcare professionals or mental health professionals previously, it's not going to be easy, maybe scary the first time in terms of sharing that. The other piece is just trying to remember those open-ended questions. So in an individual that talks about having gender dysphoria, I'll say, well, tell me more about that. Tell me more about things that you've done to cope. Tell me more about things that you've done to, you mentioned that you have concerns about your size or shape. Tell me more about that, or tell me things that you've done over time to manage your weight or to cope with that anxiety or distress. So that really gives them an opportunity to be pretty open in terms of what they're sharing. And I know that's probably basic for most folks here, but it just is a good reminder, especially in the busy world that we live in, to just take a step back and say, well, tell me more about that. Because also it allows them to share what's most pertinent to them. Before you start asking the questions that you feel like are most pertinent to them or most pertinent to what they're presenting with.
Thank you, Martha. And Ashley, I want to hear your thoughts that you have for, as everyone was talking about, sort of what should providers do, but I've also heard you talk about the really important dynamic around body positivity and how that can also, just like what are some things that folks should consider around body positivity and that movement in relation to gender dysphoria. So I'm tacking that on too, if that's okay.
Yeah, so what I'll sort of, I'll start it and then I'll pass it to Martha. So I think in some, a couple things. The first thing I wanted to say was really sort of around, and this is sort of my plug, right? Because of my lens, I'm always working, so versus working always with clients with eating disorders, I'm always working with trans clients, some of them who have eating disorders and or body image issues that are really challenging their eating or things like that. Not always, but anyways, so my plug is really around gender affirmation, right? This idea of when you're working with trans and non-binary clients, that you're always sort of centering a gender affirmation. And that means lots of different things, but that is such a core part of every minute of trans people's lives, that we really need to sort of make sure it's integrated into our treatment. And it's sort of everything, like Ryan said, like, do I feel comfortable in this space? But also helping people through the therapeutic process begin to understand what affirms them. A lot of times people don't know. If you're early in the process, you don't totally know. All you might know is that you feel different or you feel uncomfortable. You have not yet begun to explore what it is that makes me feel good, what it is that feels right. And I won't often know until I try. Usually people haven't had the lovely opportunity to try until they're given space. Maybe this space, our therapeutic space, might be the first time to try doing something different, right? So gender affirmation is about the physical body, but it's also about how we hold ourselves, what we call ourselves, what we put on our body, how we interact with our body. And so all of these experiences change the way we feel about the body that we're housed in. So that aspect of gender affirming experiences, some of them are very obviously medical, right? They are very clearly medical. And so, you know, to people's points about when these medical interventions are made inaccessible for folks, that is just tragic. And we have a lot of information on the center website about the importance of gender affirming care. So obviously advocate for gender affirming care across the spectrum, but it isn't always medical, right? Sometimes we as providers find ourselves caught between a rock and a hard place when the client is a minor and the parents are saying no, even if they're not in, you know, Texas or Arkansas or Florida or wherever, and maybe they're in a great part of the country and someone else is still saying no. We are in this position and they are in this position, but there are still gender affirming experiences that don't include restrictive eating that we can help individuals embrace. And so part of what they're doing is actually, right, it's quite resilient and quite resourceful when they're like, I can figure out how to stop menses. I can figure out how to get a straight body shape. Unfortunately, they may or may not know a lot of the risks involved, but what they are doing is they're really just trying to affirm themselves. And so part of our work is really about figuring out how do we help our clients learn to affirm themselves in ways that are safe, in ways that are healthy. How can we support that? And so to that end, I'm just going to quickly bridge to Angela's question, which is this idea of body positivity, but also like self-acceptance and self-love broadly is a really important concept in therapeutic sort of well-being, and also a really dicey one when you're working with a trans person who is not actually supposed to just accept things as they are, right? So there's this interesting thing of how do we balance self-love and self-acceptance with gender affirming care, gender affirming experiences, whatever those might be. And so as practitioners, really thinking deeply and being really intentional about how you work with clients of all ages, 5, 15, 25, 65, around this idea of there are always things that we're going to have to sort of accept and love about ourselves that maybe we wouldn't have been our first choice, maybe would have been, but other things are things particularly sort of that we really absolutely must and do need to change. And for some trans people, maybe that means getting on blockers and then hormones, or maybe that does mean top surgery, or maybe that does mean, you know, something else that is medical or legal. And those are really important and critical sort of parts of being well and healthy and happy for trans folks. And there's also these other dimensions. The reason I say this is because a lot of times we think like, what good could, like people are like, well, what could go wrong with self-love and what could go wrong with self-acceptance? Well, when imposed upon somebody who's struggling with gender dysphoria and suffering, then it's not really helpful. So sort of thinking about what that looks like, sounds like, and feels like through the lens of gender dysphoria and gender affirmation. So I'm going to sort of end there and pass it to Martha because she has some, I think, some really lovely concepts to add to this.
And actually, some folks in the chat have already been bringing it up, which is that what we talk about in this circumstance, again, pointing out that body acceptance or body positivity at this time, encouraging that can be very invalidating, and that really what we're talking about is trying to get a person to where they need to be. And that's a journey that takes time. And for adolescents and youth, it can take parental consent. And so we often talk about, as folks mentioned in the chat, the concept of body neutrality, that the body is a vehicle for living and doing. It needs to be nurtured with adequate food, water, rest, and care. We talk about that your body is something that you may want to move to do things. What are the things that you want to do? How are you going to use your body to do the things that you want to do while we get you to where your body needs to be to match your gender identity or to closer match your gender identity? And that often helps some of our patients really get to that point of it's really more about survival and ensuring that we're going to keep your heart beating, we're going to keep your organs functioning, and we're going to work to get you what you need. What are the things that you want to use your body for in the meantime? And actually, more and more we use this concept honestly, in patients with eating disorders more broadly, in that our bodies really made to be on display, or are our bodies made to be used to live our lives? And how do we want to use our bodies to live our lives? It's going to be different for someone that has gender dysphoria. So I don't want to equate those two, but we do use that concept across the board and find it very helpful of like, let's keep you alive. Let's keep you going. What kinds of things does your body do that you like going on hikes or going somewhere with your partner or whatever it might be. And let's keep that going until we get you what you need. I would love to hear comments from Ryan too, in terms of additional comments you have about that as well.
Yeah, I definitely agree with you, Martha and Ashley, on that subject. I think speaking from experience and from seeing trans kids that have disordered eating, it just brings up the idea of the importance of gender affirmation. The idea that with kids that don't have access to gender affirmation, they're struggling longer and disordered eating is getting more harmful and serious. I can speak from experience that with gender affirmation came a significant decline in disordered eating, that it dramatically changed my world in being able to be affirmed in myself and who I am.
I think this has been a really powerful conversation, and we did have a question related to that, but I want to pass it to Martha quickly.
And I was just going to highlight something. I think there was a question earlier about how do you handle a situation when you have a parent that's not supportive of gender affirming care. And I think that's that can be very challenging for individuals who are assigned gender female at birth. We can use birth control without parental permission. In most states, you can consent to birth control without parental permission. So sometimes that is one thing that we do in terms of, from a gender affirming perspective, to at least stop the menstrual cycles. And then for individuals, we talk about other ways that from an affirming perspective, we talk about names, we talk about pronouns, we talk about how, who they want to present their gender to, in what setting, where it's safe, and give them that opportunity to practice. For some, in coming out in the office, it may be the first time that they've said it out loud, and it's very rewarding for them to hear us use the pronouns that they need used and use that in front of others, whether it's our staff, it may not be their parents yet, but then just continually to build on that so that over and over and over we're affirming their gender. Certainly we will refer patients for other things depending on their needs. What I tell everyone is everyone has a different journey. Everyone has a different way that they want to affirm their gender. And so, you know, part of it's me better understanding where you need to go from you. And you helping guide me, and I can direct you towards resources and support when I know what your needs are, whether that's hair removal, whether that's Botox, whether that's name changing, whether that's gender mark changing, whether that's additional time with parents and gradually setting goals. It might be first just having the parents use pronouns first. We know that for teens, actually the most important thing is using accurate pronouns. It's actually more important to kids than getting that gender affirming care. Of course, gender affirming care is very, very close second, but at least in studies, kids feel more affirmed when their parents are using appropriate pronouns. So I'll have parents that bring kids to care, they're getting them hormones, but they're still using their dead name or old pronouns, and that's not going to be as affirming. So keeping in mind how we approach it with our patients is again going to be very individualized.
I think, you know, part of this is, and we're sharing good research. And I had somebody email me the other day, a clinician, I think they were actually in Arkansas, and they said that one of their main things they do is really grab as much good research as they can to really use it with the parents, right? Really helping parents look at what the science is saying about health and recovery. So the more educated you are on sort of the importance of sort of gender affirmation in these small, sort of small and big ways, how much it improves the things that the parents really do care about. Like the parents can usually really do care about helping their children, recover, become healthy. They don't always see the connect, right? Like they don't get the connect, but they do usually believe in promoting health for their children. So helping them, I mean, that's a slow road, I get it, but I do think that the more you're able to talk about and understand and utilize the research to advocate for your clients, parents are able to believe science sometimes when they don't believe their children. So we try to use that whenever I can.
And we have so many good questions coming in from the chat. I think we'll only have time for a couple more, but I'll ask the ones that I feel like have not been touched on at all today. One that just came in asks, should parents assume that children who were AFAB will experience dysphoria around puberty when they get their period?
So I would say that no, you can't make that assumption, because there are some kids, some people who feel so sort of understanding one's trans identity, there's not like a singular pathway. That's what we do know now. There's not one pathway to there's not this sort of linear path to sort of identifying as trans. I think that obviously if someone knows their child is trans and they're having these open conversations, that a lot of times it is really sort of helpful to be linked up with the gender clinic in the area, the providers in the area, to help assess and explore what kinds of things exacerbate a young person's gender dysphoria and what things help affirm them. But it's not always so. For some kids, their periods are really, really, really huge deal, and for others, that's not what bothers them the most. For some kids, same thing with breast development. That's a huge deal for some kids and not for everyone. So that's a really important piece about gender dysphoria, is sort of those things in isolation aren't like indicators of someone is trans or someone's not trans. Sort of like a constellation of experiences, and sort of you as a provider recognizing that there's a lot of ways that gender dysphoria can manifest, and a lot of ways in which certain things might be absent that you might expect to be there and aren't, and that doesn't make a person less trans or not trans enough. So really sort of and sort of this idea that it's not always like 12 or 13 when it happens. Sometimes people really come to understand themselves, well, much earlier, and they're very clear they never want to go through puberty, or much later, and they're sort of still making sense of things, but it's not all super clear to them, and they might not exactly have the same language that you'd be expecting to hear. So part of it is sort of like Martha was saying, making sure you're sort of, with any adolescent you're working with, always sort of having gender identity conversations, sexual orientation conversations, the idea that our understanding of ourself continues to grow, it's fluid, and sort of especially around body and body image and gender norms, having these sort of open dialogues that are really client-led, where we are not imposing our sort of script for what it looks like to sort of understand oneself, or what gender dysphoria looks like. And there's a lot of like a growing database on good articles that sort of help point out the nuances of gender dysphoria, so that it's not sort of this lockstep thing that we must expect, and when not there, it's not there. So I think that could be helpful as folks are reading up and watching more things.
Yeah, I appreciate that. And I think I'm going to squeeze in one more question that I think is a good one to end on for today. And just as a reminder to everyone, anything we didn't get to, we'll send out a follow-up email along with all the resources shared today. So you will have that coming to you. But someone asked, do you have any suggestions for how to support trans girls in believing recovery is possible when there are not as many trans women in the field or vocal about having access to eating disorder recovery? And I think it's a good question to end on. I'd like to expand it to sort of transgender people generally. How can we, what can we do to help make recovery more visible?
I'm not sure I exactly understand the question, but what I'm hearing is ensuring that transgender individuals have access to eating disorder care, and that we understand what recovery might mean for them related to eating disorders. Is that kind of?
It was almost like maybe we're role models or seeing successful examples of trans women who are in recovery, or trans men who, I think it was like that.
Yeah. So I think you'll see in the presentation that I did, there's a number of organizations that I think you can follow. There are several Instagram accounts that I encourage patients to follow or look at and to decide whether they want to follow it. As well as the Fed Up Collective is, I think, one of the good organizations that really focuses on eating disorders in individuals that don't fit the gender binary norms or other what are considered typical or stereotypical eating disorder populations. And so I think they have a lot of good resources. That's probably one of the places I would say off the top of my head that I direct patients to most commonly. And then again, there's several other resources listed in the presentation that I that's linked, lots of names on Instagram. There's also some TikToks as well that some of my patients who are cooler than I am will follow, as well as I was just looking at my presentation to make sure I didn't forget anything, but the Fed Up Collective is the Fighting Eating Disorders in Underrepresented Populations, a trans and intersective collective. I think that's probably one of the best places to go.
That's great, thank you. And we can certainly go through the presentation and work with the team here to make sure that you're getting all of those resources in the follow-up email. So that should be comprehensive and should have lots of links to things that you all can use. So with that, I think we have to end today's session. We are out of time, but this has been really amazing. Great discussion. Thank you so much to all of our panelists who spent the time sharing their wisdom and expertise. And we hope to see you again on one of our future presentations. So thank you, everyone.
Thanks. And thanks to such a interactive group of attendees. Lots of typing going on. Thank you.
Terrific questions.
That was great. All right. Thanks, everyone. See you again soon.